Month of March is Endometriosis Awareness Month. Here we are at TX Hospitals. I am Dr. Sudha, a Chief Consultant Gynecologist and a Laparoscopic Surgeon at TX Hospitals, Banjara Hills, and we are here to create an awareness on this endometriosis, which is an incapacitating and dreadful condition for the young females. So what exactly is endometriosis? The inside lining of the uterus, which we call as endometrium, which undergoes changes during each menstrual cycle because of the hormonal changes, because of some factors, some genetic, environmental and abnormal lymphatic drainage and blood supply, they are seen outside of the uterine cavity. Most common sites being ovary, fallopian tube, inside the pelvis, behind the uterus. So when do we suspect a patient is having endometriosis? Is when they have severe incapacitating pain during periods, they're having difficulty to conceive, having a painful intercourse, or having pelvic pain, just deep in the pelvis, severe dragging type of pain in the pelvis and pain while passing stools during periods. So these signs, symptoms, if they are there, if they come to a doctor, there are some investigations which we do. Ultrasound pelvis, especially transvaginal scan, is a very useful modality for us to detect the endometriosis, but the actual 100% diagnosis is by laparoscopy, wherein we see, because sometimes there are different types of endometriosis. One is superficial and one is deep infiltrating. The other one is being minimal, mild, moderate and severe. Some of them, they are not seen on the ultrasound. Only when we put in the telescope, we see these sometimes like a patches, white patches, yellow, brown, black or severe scarring. So all these are signs and symptoms of endometriosis. And how do we treat it? Treatment is based on the age group, based on the symptoms with which they come to us. If it is infertility, then if the size of the cyst is more than 4 to 5 centimeters and it is interfering with the egg collection and all during the IVF, we need to do it. Otherwise, if it is more than 4 to 5 centimeters, causing the patient to suffer a lot, and it is increasing in size and not reducing with the medical mode of management, then surgery is a definite treatment of choice. And mind you, what we want to tell you is that there is no 100% treatment for endometriosis, because it keeps on recurring. Because every month the lady undergoes these menstrual cycles. Over a period of there is a risk of recurrence. 20 to 30% of the ladies have these recurrences. So the first surgery should be the best surgery. And let's all be aware of this endometriosis, and coming to the doctor early, seeking early medical advice and treatment goes a long way in preventing the complications. Thank you.